can't really give you that number.
We've had a lot. They're not even
Yeah.
testing for H1N1 anymore.
Unless they're specifically
unless there's
requesting.
a paramount reason to do so. Correctly. Yeah.
I mean, do you know a minimum? 'Cause I remember we got a release, the first H1N1 confirmed, even with the thought like, hey, yeah, there could have been twice as many, but is there some number of, yeah, we had 5 confirmed, 1 confirmed, only that 1 confirmed? Is there some number?
Oh, we've had well over that.
No, just explain the state of Texas.
Yeah.
It's not
The release number that
Yeah,
you-
flu, go ahead.
Right now, the state of Texas, influenza is not a reportable condition. However, for San Angelo, as the health department, we are in the process of getting everybody to report the positive flu type A, flu type B. And at right now, the ones that are coming out positive flu type A, they are assuming that it is the H1N1. 99% of the ones that are being tested right now across is in the United States is coming up H1N1. So H1N1 is a prominent flu virus that is going around right now.
What's the kind of treatment that they're giving to this influenza? Because I understand that antibiotics are used in some kind of influenzas.
No.
Antivirals are what we're using to treat the influenza, whether it's H1N1, type A, type B, typically Tamiflu or Relenza. Now, these medications aren't necessarily required to get over the disease. In healthy individuals, your body's immune system will fight off the virus, just like it did before we had all these medications. The antiviral medications will shorten the course of the illness a little bit, and so if we catch it early enough on, in the first day or two of symptoms, we will give some patients the Tamiflu or Relenza to help them get over it. Certainly in cases that are more severe, but again, it's not necessary. Now, in the cases that are where the patients are extremely sick, well, then that person needs to be in the hospital for further care.
After, I don't know, about 6 months that the H1N1 is discovered and diagnosed in people, do you have a death rate that it's available? I mean, how severe it's going to be the H1N1 versus the regular?
That's a great question. And last year, we were all very scared that it was going to be more severe. In fact, the H1N1 strain is no more severe, perhaps less so, than normal type A influenza. So, again, there's no need really. We keep talking about swine flu and H1N1. There's really no need to separate them out. It's not an identifiably different disease. It's not any more severe. And so, as far as the incidence, I think the CDC, the Centers for Disease Control, has numbers about the incidence of, in general, flu and the complications that occur with that, whether it's hospitalization or prolonged illness. They have those numbers on the website. Again, we are seeing a whole lot of flu in town locally. It doesn't matter what type it is. In the sense of treatment, it all ends up being the same.
If a person would come down with the flu, they know they have the flu, would they be able to tell which kind they have by the symptoms?
Not at all. Not at all.
I think a lot of people are just saying they have the swine flu. They may not even know.
That's correct. A lot of people, last year we made a big deal about trying to confirm whether it's H1 or N1. They're not doing that now because, like Ms. Aguilar said, the predominant strain of flu that's going around now is H1N1. It doesn't matter. It's just like the other type A flu. You treat it the same. The incidence of complications is the same. And so a lot of people, in fact, will just be tested and be told they have the flu, and we're assuming that it is H1N1. It's not any different in that respect.
So why both shots, what's the stress for getting both?
Well, you know, and I guess that's because, you know, they are different strains, and that's one of the interesting things about the flu virus itself. Every year the virus mutates, and so the strains continually change, and so the type A influenza that we had 3 years ago, say, is different than the H1N1. The strains are no more deadly or than any of the others. It's just different, and so the H1N1 is an updated vaccine. It's a little bit newer, and so if you want to be completely covered, or well, nothing's complete, but if you want to increase your chances of not coming down with a flu-like illness, you get the type A, type B vaccine, and then you get the H1N1, and 3 years from now it'll be a different one. That's just the nature of the flu virus. Well, there are a whole lot of people out there that are scared because of different reports they've heard, and we just want to make sure that they understand that there are things that they can do, both to keep from getting the virus, whether it's a vaccine or if they do get the virus, how to treat it, how to keep it from spreading. So we just want to make sure that there are no misunderstandings out there, that people feel comfortable with, the situations where they, may be in church or may be in school with people who are might be sick. Hopefully, anybody who is running a fever, does feel like they have the flu, will stay home, just so that people can all be informed about the whole process and how best to deal with it.
I don't like not being able to give straight answers. And your question a while ago about the testing and about being able to have a hands-on number, when the H1N1 became a pandemic, meaning it had actually made its way around the world, back in the summer, unless you were hospitalized, they had kind of stopped testing further. Basically, if you had the flu, you had the flu, and they were treating accordingly. What we found out was that based on that information, that we were getting lots of people who were calling and saying, my neighbor got tested and they're positive for H1. The kid came back to school and told us that they're positive for H1. That was one of the big reasons we started doing a little added research. As Ms. Aguilar told you, that flu is not actually a reportable disease. But in this situation, we started making phone calls, and we found out that local doctors and doctors in the surrounding areas really were sending on lab tests by request from the patient's family, to find out specifically if it was H1. That's when we turned around and said, okay, we're going to make this reportable this year so that we have our hands on a better number. At this point in time, can I give you that number yet? No, I cannot. Here in the next few weeks, we're going to be able to give you some good, solid information. Flu is the flu. It doesn't matter whether it's what strain it is. Flu's the flu. That was the main cause for this news conference, so that people would understand we're not dealing with a rare disease. We're dealing with something that's out there 365 days out of the year. We're dealing with something that is very workable. People normally get over it on their own. There are a few, as Dr. Seifert said, that do get very ill and do have to be hospitalized. And even sadder, there are some whose immune system don't tolerate it, and we do have some loss. And for that, everybody is always very sorry. We just want to make sure that the general public has good, solid information, knows who to call, who to talk to, what websites to go to, where to get good, solid, unbiased information. That was the main concern for all of this. We really appreciate y'all coming and taking the time to follow up with us and work with us. Basically, we're a community. In our situation, we deal with not only San Angelo, Tom Green County, but the 13 surrounding counties, and we consider that a big family, and that we want to keep everybody safe, everybody healthy, and make sure that they do know what they need to do in any given situation.